Hey, 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 welcome to the Green Nurse Podcast, where we bring hope and inspiration for growth and healing. We're here to change the dialogue and stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. There are a lot of great people out there and amazing companies that are making cannabis formulations for patients. And a lot of these companies are selling these wonderful products. But yet, no one is truly educating medical patients on how to use cannabinoids as medicine. That's what we do. That's what we're going to be focusing on this year in the Green Nurse Podcast, bringing you more education to go with all of the interviews of the different people and companies that we're interviewing. So here's a little video about what we do in the cannabis space as cannabis nurses. And then we're going to dive right into the interview with Thomas Schnackenberg. Here we go. All right.
Change the paradigm of healthcare.
The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I'm the founder of Holistic Caring. We're based here in California, and we do educational programs and case management for patients on how to use cannabis therapeutically as a medicine.
We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing.
As the founder of Holistic Caring, I basically oversee the whole ship, and what we're doing is progressive education.
Cannabis actually supports all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to either do something or not do something. Because the plant was prohibited, it prevented health professionals, doctors and nurses from learning about cannabis as medicine.
I want to change the paradigm of healthcare and us paving the way into a new vanguard of medicine. And I'm excited to really bring this into light. There's a company called Canum that we're merging with, and we will now be doing global education.
It's about education, it's about empowerment, it's about teaching people how to feel good, bridging the gap from what they're not getting from traditional medicine, utilizing different plant medicines, adaptogens, tips, tricks, hugs, and nugs of information to support and nourish the most important system in our body.
And it's a lot of soul work, a lot of love, a lot of discipline, and meditation. I'm using my life work as a testimony to others to learn how they can be their own hero and then go help heal the world.
And we are, as nurses, the game changers. All right, well, there you go. Growing in health, growing in cannabis. So welcome, everyone. It's been a while. And as you know, we've been highlighting cannabis nurses, health professionals, and companies that are formulating products as we are truly in revolutionary times where we are changing how we approach and take care of patients. You've heard us all talk about Green Nurse Approved, and tonight's show, we are going to be highlighting one of our Green Nurse Approved vendors who will be formulating for us as we expand holistic caring across the globe. Thomas Schnackenberg is the founder of Bloom Hemp. He is a multifaceted entrepreneur with a plethora of experience in varying roles. Throughout his career, Thomas has overseen many different aspects of business and has developed a clear perspective on the cannabis industry as a whole. He is directly responsible for creating products for over 100 of the top brands in the cosmetic, topical, and hemp spaces. Tom is extremely passionate about creating products that help others. When he founded Bloom, he was able to bring this dream to reality. Bloom Hemp focuses on delivering unique hemp-based products to consumers. Founding a successful company has allowed Tom to develop a comprehensive professional skill set. As founder, he is well-versed in leadership, operations, sales management, client relations, and manufacturing skills. As an individual and professional, Thomas is passionate about all things wellness. He is a firm believer in taking care of the body and is constantly looking for new opportunities to help others do the same. Sounds like we're on the same mission, Tom. Live your best life and help others do the same. Welcome, Tom. Really, really excited to have you here and meeting you for the first time on the podcast. And I'm excited to share your story and what propelled you. What is your compelling story that propelled you to start Bloom Hemp? Because you and I both know we don't wake up one day and just say, hey, let's work in the cannabis space. You know, there's usually a very compelling story that goes along with it. So very, very happy to have you here today.
Yeah, thanks for having me, Sherry. Yeah, it's been a wild ride the last, it seems like 8 years now in this space. I moved out to Colorado a while ago and was looking to kind of find some work, and I kind of got into CBD and cannabis before the wave actually hit the mainstream market. And I was lucky enough to get in with a company out here based off of a friend just giving me a call and understanding I was looking for some extra work since I came up to Colorado. And I at the time didn't even know what CBD was. Like it was,
right.
I don't think many people knew what it was at that point. And so when I got involved with it, we were one of the first companies to really get started. And we were an e-commerce brand, and like any type of startup at that point, you kind of wear multiple hats. So I had owned my own companies in the past. And so this was a very intriguing opportunity for me, ground floor of a new industry, and not any really people didn't know about it. And at that time, who knew it was going to take off? But once we got really going and things, I started to see what this plant was doing and how it helped people. And at the time, we were just a small team of 5 people. So we were doing sales, we were doing marketing, we were doing operations. We were doing everything. And so the team grew rather quickly because when was it? Let's see, it's 2022, probably like I said, 7 years ago. And so you kind of felt this wave building in this space. And you could kind of just see people being attracted. Oh, CBD here, CBD there. And you just start seeing it more and more. And we were fortunate enough to be in a position where we were kind of a first mover in this setup. So long story short, it just kind of happened because I got involved with it just based off of some connections I had. But when I first got involved, it kind of felt like, okay, what are we doing here? Who is this helping? How are we helping people? But where it really started to hit, and we started to really, or for me personally, it started to feel like, okay, this could be a little bit more than just another job. This could be a little bit more than just another company or startup I helped get off the ground. Was we had a storefront, and we'd have people come in and buy the product from us up front. And you'd see people from all different types or walks of life come through. They'd have their pain, their back pain, or they couldn't sleep. And so we would recommend certain products. But what really kind of pushed this forward was when I met a kid with epilepsy, and his dad brought him in, and the kid was having over 30 seizures a day. And it was heartbreaking. And medications weren't working out. It just, what they were being prescribed by doctors wasn't doing it for him. And so we recommended CBD isolate, because CBD isolate, I'm not sure how familiar you're with how familiar your viewers are with it, it's a very potent version of CBD, the most potent. Actually, it comes in a little white powder form. But what's great about CBD isolate is when you put it under your tongue, it dissolves immediately. And so our thought process was, let's get the CBD into this young man's system very quickly, so we could break that blood-brain barrier very fast, and he could get the CBD when he's having the seizures he needs. And so we sent him off with probably 5 grams of CBD at the time, and CBD isolate. And within 3 days, they came back and bought more. He's like, I went from having 30 seizures a day down to 0, literally overnight, by taking this product. And at the time, I was like, there's no way. Like that's insane to me. It was mind blowing. And that was the moment that I felt like there was something to this more than just, hey, this is not just another cannabis product that that the stoner is buying out there. So that was a big deal for me.
Yeah.
I'm sure you have your stories as well, because everyone that I've met that's in this space and has been in it for a while kind of has a similar situation where
Oh,
that
yeah.
light bulb just goes on, right? And you're just
Yes.
like, oh wow.
Yes. So, for the new viewers that are out there, what I would love to break down just really quickly is the difference between CBD isolate, broad spectrum, and full spectrum, because you carry all of those products on your website. So for
Oh
the
yeah.
new viewers, when we're teaching on the endocannabinoid system, so CBD isolate is the isolated molecule. It is the one and only molecule of CBD. That's it. It's very similar to a pharmaceutical, but it does have a very big therapeutic window, and it's the primary ingredient that's used in Epidiolex.
Mhm.
So CBD isolate. So then what we do is then we have a broad spectrum CBD, which is whole plant, 0 THC. And then we have the full spectrum CBD product, which is whole plant, including the trace amounts of THC, which is less than 0.3%. And so the difference between hemp and cannabis is really only a lab result. Right?
Mhm.
Cannabis has greater than 0.3% THC, where hemp has less than 0.3%. So I really, really like too that your story on that, because CBD isolate too is gotten a bad rap from a lot of people.
Yes, which
And
is insane to me.
I completely agree with you, 100%, because especially for people that are new to cannabinoids and new to cannabis as medicine, and they're used to single isolated molecules. They're
Mhm.
used to, this is a product that could be very safe. I saw on your website that you had CBD isolate. People could make their own tincture using CBD isolate and MCT oil. Seriously, you could
Mhm.
make their own, and would be a really, really great way to start taking it to get comfortable with it. One of the things, and this is off topic, but I'm just going to share. My mother was plagued with stigma. She was afraid. She was afraid of the whole plant, but learned enough about CBD. And when she saw that it was patented by the government, was when she was open to trying it. But she only wanted that one isolated molecule. So we did CBD isolate and MCT oil, and we called it her safe product, right? Because
Yeah.
she felt safe taking it. Right. And it was a way that she could get it in sublingually. She could use it as a topical. She used it on her face, and she was convinced. It took her a little while, but once she was on it for a considerable amount of time, just using the isolate, she got comfortable to advance to the next level, which is the broad spectrum. So anyways, getting back to the seizure disorders, I think that's absolutely fascinating, and
Yeah.
that's actually a really good nug and a tip and a trick for people, because the isolate does immediately, like you said, you can go under your tongue, you can give them a dose of it, and
Yeah.
break that seizure right away.
And I personally, I wish I had like the raw material to show you that, like the full spectrum versus I could have a nice little show and tell, but I mean, I'm out of the office for the day, so I'm
We'll
in the
do it next
basement right
time.
now. Next time we'll do it. But
Yeah, we're
it's
gonna
one of
try.
those things, like I personally am a full spectrum fan. I get the most benefit
Yeah,
from it, but I can't discount the fact that some
yeah.
people benefit more from isolate. And that's where I struggle. When someone says, oh, this one's better for this one's 10 times better, isolate, it's not good. It's like, no, it's just, it doesn't work as much for you.
Right.
CBD and different types of products, it's such a personal thing. When we start
I
selling
agree.
products to people, or even to companies, when I work with companies like you guys, like what is the purpose that you're trying to achieve here? And we almost back into a product for you, because certain things are going to affect certain individuals differently. So we always recommend, like, hey, sometimes this product might not work best for you, but we have something else that will. It's not
Mhm.
the glove doesn't fit everybody.
Right.
It's you got to find the right product that's for you, along with the right dosing too.
Mhm.
Because I mean, what a dose for me? I'm 6'3", 200 pounds is going to be different for someone else that's 5'5", 100, 150. And so like that's one of the things we're really working on and trying to educate people, like how do we find that specific dose? What's the goal of this? Is the goal to sleep better? Is the goal
Right.
you have a back pain that's just kind of stubborn? Is the goal to just kind of we want to alleviate that pain? And so I mean that's the beauty of the different types of CBD and other cannabinoids, which we could go down a road for
Oh,
days
I know we
on
could.
those. But I mean,
I
it's the
know.
purpose is guys that are listening, guys and girls that are listening out there, is make sure to give CBD a good trial period to find the right product. We have people all the
Mhm.
time, they'll buy a tincture and they try it one time and they say, okay, well, I really didn't feel anything. And I'm like, okay, but you tried it one time. You took one dose,
Mhm.
tried it one time. You need to sit back and you need to give this 2 weeks or so
At
of
least. At
consistent
least.
of consistent dosing, not twice, one day, then three days later, but consistent dosing, because your body is working at a deficiency with your endocannabinoids. So
Mhm.
the goal of taking it is to replenish that, and that takes time. Like I
Right.
like to use this reference all the time. Is if you have a vitamin C or D deficiency or whatnot, one pill isn't going to fix that. One,
Exactly.
like, I mean, you got to consistently do
Exactly.
it if you're truly interested in improving your sleep habit, your sleep, your back pain, and on top of that, also do other things other than just take CBD, like to help with that. Like if you have sleep
Right.
issues, use your CBD product. It has, like, for example, our calming tincture. We got lavender, hops, lemon balm, California poppy extract in it. Yeah, all of those ingredients help promote a quality sleep. But at the same
Mhm.
time, take it upon yourself and put your phone down an hour before you go to bed. Maybe read a
Right.
little bit too, and let's let the body
Yeah.
naturally work together with
Yes.
those products to help you promote that. It's just
Absolutely.
it's a
And that's
cycle.
Well, that's exactly what we teach too, as well, because
Mm-hmm.
as cannabis nurses, when we're teaching on the endocannabinoid system and the safe utilization of plant phytocannabinoids, we need to teach people to remember that the endocannabinoid system is working 24/7.
Mm-hmm.
It's an on off switch going on off all day long. So it
Mm-hmm.
makes sense to microdose, to utilize these phytobotanical nutrients more frequently to mimic the endocannabinoid system. We have an endocannabinoid system not because of the cannabis plant, but because we make molecules in our body that are very similar to the plant. And it's constantly working. Every single thing that we do or don't do in our lives in regards to health and wellness, whether it be eating, sleeping, exercising, what we consume, what we watch, what we put into our mind, body, and spirit, actually affects how cannabis and CBD products are going to work in our body. So when you hear all these nurses that are preaching, you got to exercise and you need to eat right and drink more water and cut out the alcohol and take some supplements and work on decreasing those pharmaceuticals. There's a reason for it, because
Mm-hmm.
every single thing that we as cannabis nurses tell you to do or don't do is gonna support your endocannabinoid system. We want you to be doing more of what supports and nourishes that system and less of what doesn't, because it's going to make your product work better.
Correct.
Period. Right?
100%. And I
Completely.
think that's a very good point in what you're saying is be proactive and get ahead of this stuff, and don't lean so heavily on like the instantaneous results, which is a problem. And we could go down again another rabbit hole of like just society, instantaneous results. This is something that needs to be part of your life daily. Like, I mean, every morning you wake up, or if it's for the sleep tincture, I mean, do it consistently. You can't preach that
Yeah.
enough. And the people that do that, they really do get to experience the power of this plant, not just this plant, but other botanicals and terpenes and things like that. We didn't even go down like a true full spectrum, including the
Yes.
terpene profiles that really help with the endocannabinoid system. I mean, terpenes are an incredible thing, and just how they interact with the body, and just how they're all over the place. You walk through the forest or something, you'll smell terpenes coming off of the plants, and that's why when you're walking out there, not just because it's awesome outside, great weather, whatnot, you feel refreshed almost because you're smelling those terpenes that these
Right.
plants are putting off. And like in hemp, I mean, it's got a very wide range of a terpene profile that we're able to kind of navigate and insert into these products to help you with specific ailments. So that's
Right.
a I mean that's an incredible benefit of like that true full spectrum profile that we
Yes.
kind of talked
Yes.
about. And like there's so much education behind that too. And so That's why I said earlier, this isn't like the glove that just fits one hand area. There's so many different facets to these products that people are not really just now scratching the surface, and really the consumer right now is just starting to realize that these products are very helpful and can help them if they take the time to put the energy into using it like they do some of their other vitamins they might take.
Yep. And that's why we have our free off social media network for everyone to enjoy and join. So at holisticcaring.com, we have a free network, free introductory to cannabis course, free patient portal, free support group, free book club, and it's all run by registered nurses that are teaching on the endocannabinoid system and the safe utilization of plant phytocannabinoids. And Bloom Hemp is one of our Green Nurse approved vendors. We're really, really excited. And I want to talk about a couple of your products here, because I've been, as a matter of fact, we've been formulating. Elizabeth and I have been formulating using your botanicals, with your formulator, and creating products. But one of the products I really want to mention, and you'd said that it's something that you created for your wife.
Yes.
Right?
Yeah.
And this is really, really critical. And the reason why I want to talk about this is because there's a lot of misinformation. So people will look at this digestive tincture. Oh, well, I don't have any digestive problems. Guess what? Guess what? Your digestive system is completely 100% connected to your microbiome, which is also connected to your immune center, your immunity, also connected to your central nervous system. So our enteric nervous system, which is from our mouth to our butt, right, communicates to our central nervous system via the endocannabinoid system. So this is when we talk about mind, body, spirit. We talk about the second brain being in the gut. This formula, I'm just going to give a quick testimonial on this because this is really important. As you all know, I've been traveling and I haven't been around. And you all know my story. And if you haven't known my story, I have a problem with gastrointestinal. I had a chronic autoimmune condition that pretty much left me plagued with morning nausea. And I generally have to inhale most mornings in order for me to get in my tinctures and capsules and my other supplements. So I was traveling out of country, and in a couple of the places, I wasn't able to bring my inhalation devices with me, and I didn't want to get in trouble. So I really followed the rules strictly. But I had my handy dandy digestive tincture. And I'm not going to kid you, in the morning, I took a half a dropper of it. It's a 1,200 milligram digestive tincture. We'll go over the other ingredients in it. And I was nervous I wasn't going to be able to eat. I was really, really afraid. And when you have chronic nausea, you know what I'm talking about. You know the fear, okay? When you had to get up, get out, eat, and work. And having that nausea where you're sweaty is horrible. Half a dropper of this, I'm not even kidding you, 15 minutes later, the nausea was gone. I was able to get into my other oils, and I was able to eat, and I was able to function. I did not need to inhale. And that's the first time that's ever happened to me with a CBD tincture. So thumbs up.
That's awesome. I'm glad to hear that. Yeah. It's just benefited you so well. It's my favorite product that we've made.
Let's talk about the reason why. Yeah, I want to talk about the reason why.
And the reason why was kind of a similar story there. It's just nausea's a bad thing, and it's not fun to deal with. And actually, my wife's pregnant right now and dealing with a lot of nausea as we speak. So like, we don't really use too much of the CBD products at this time for it. But point being, when we made the product, she wasn't pregnant, and she was experiencing that nausea in the beginning. And I also kind of, after big meals, I would feel very bloated and like just low energy. And so I was like, well, what can we do here to kind of kill two birds with one stone? How can I feel the energy levels kind of come up after a big meal? How can I help you with your nausea? So based off my past experience, it was like kind of reverting back earlier in the conversation, is when we first got into this industry, I learned how to formulate. It was, just something we were doing. We were making this. No one knew what they were doing. No one understood how to make this. And so we figured it out. And so I found it very interesting to, in the beginning, the basic products were MCT oil and either CBD isolate or the full spectrum and broad spectrum oil that we talked about. Very basic. And so once we started doing that, we started really pushing those out. I got a little bit more creative with some of these blends and started thinking, okay, now how can we make these a functional tincture? And this is the point where, like, dealing with the nausea, dealing with the bloated, or like being bloated after big meals and things, and not having the energy to go about the day after having lunch, and just feeling just kind of lethargic for the second half of the day. I was like, okay, what can we do to help with this? What other ingredients can we add to kind of help break down some of the things in their stomach that create these issues? And I was like, okay, well, let's get in here and let's start adding some things like fennel. Let's take some brown cumin extract. Let's take coriander. Let's start mixing in functional amounts of these ingredients, because it's also important. You don't want to just put a dropper of it in. You want to use functional amounts of the other active botanicals, so that way they make a difference actually in the product itself. So we started mixing these together, and we kind of found a blend that we liked. And so, being that I'm kind of a little all over the place with the story, but being that I'm not a doctor by any means, like, and these are things that I was just kind of like, okay, fennel works here, coriander does this, and then same thing, brown cumin. It all helps with digestion. So what we did to kind of certify these products to make sure that we were on the right road is that's when we brought in Dr. Sunil Pai. So we would kind of work hand in hand with Dr. Pai, which I don't know if to any of your listeners, if you guys have discussed it all, but I think he's been on the podcast in the past, right?
He has not been on the podcast, but he's going to be. He's written a book called Inflammation Nation.
So,
really powerful
so point
book.
B, yes, and yeah, this, and he's incredible wealth of knowledge and understands how all of these ingredients work directly with CBD. So, and working with him directly, building out these formulas, we came up with this digestive tincture, and we started testing it on ourselves and started noticing some very great benefits from it. Like, for example, after a big lunch or something, I would take a dropper full and see how it would go. My wife would take it in the morning, see how she'd feel. And just these problems just kind of started dissipating, and they weren't there anymore. And so it's just how we kind of walked into it is, like I said earlier, is we back into it actually. What is our problem? What are, on top of CBD, can we do to make a functional product? Because back to kind of the endocannabinoid system and how it works, it's a lock and key kind of method, right? Mm-hmm. You got these receptors, the CBD1 receptor, CBD2 receptor, and they are there, and CBD travels to them as kind of the key. So the receptors are the lock, the cannabinoids are the key, and they fit accordingly. And so working with Dr. Pai, we kind of took a different approach. Instead of just loading those receptors with CBD, it was more so using CBD as a carrier for some of these other botanicals to interact with the receptors. So taking things like the coriander for the digestive tincture, the fennel, and the brown cumin, and attaching it to the CBD, so then that will go into that lock receptor and unlock some specific parts of the endocannabinoid system that then will help with at a functional level to whatever we're trying to achieve there. In this case, digestion. Calming tincture, like, would be like using that CBD more as a carrier to take these other botanicals to these receptors to achieve something a little bit more than just a CBD product. Because that always kind of drove me a little crazy, is when, oh, what's this product do for you? The MCT oil tincture. Right. Oh, it helps my back. I sleep better with it. And I'm like, yes, that's great. I'm so happy that's benefiting, but there's something more to it that we were missing. And so my wife loved it. I loved it. It's my favorite product. I use it daily. I highly recommend it. Like I said, it's not your traditional CBD product that you hear about, like a sleep tincture or a pain relief tincture, which we definitely have, and we make things specifically for that. But this is something that, like you mentioned, gut health is a very important thing that is, I think, very much overlooked, and really does affect your sleep. It does affect your pain levels. So it kind of all starts there, right?
Yeah. It does. It totally does. I mean, your gut health, your microbiome, you have to look at it as it's its own little world, okay, doing its own little thing. And we need to support it, right, in the best way possible. You think about cell replication, right? When we're replicating cells in our body, and this is what we're doing all the time, we're constantly, cells are dying and being replicated over and over again. We want to replicate cells at the healthiest level. What do our cells need? They need micronutrients, right? We need to get micronutrients, and CBD plus these other phytobotanical nutrients and supplements that are being added in can enhance it. I look at it as an enhancer, a booster. It's going to actually make CBD is going to make these botanicals work better. These botanicals is going to make the CBD work better. It actually, I look at it as it jacks up the entourage effect. And the entourage effect states that the whole of the plant is greater than its individual parts. So when you're thinking about the endocannabinoid system, and one of how I teach is the big giant umbrella, our body is the umbrella. All of the spokes of the umbrella are different organ systems. The fabric that attaches to the umbrella are the neurotransmitter signaling systems. The endocannabinoid system blankets on top of our entire umbrella. We produce internal endogenous cannabinoids upon demand at the tippy top of our umbrella to shower on our umbrella. If we're not making enough of our own, guess what happens? Messages don't get where they need to go, and our body isn't able to perform optimally. And then we start to see a dysregulation, a downregulation, and multiple systems start to be affected. So when you're introducing plant phytocannabinoids that are rich, such as Bloom Hemp, full spectrum with these other phytobotanical nutrients, what you're doing is you're showering whole plant on your umbrella, plus these boosters, plus these other supplements that are going to enhance the efficacy of the the microdoses of THC, the CBD, the other terpenes. And it's going to be more of a rich type of a medicine to help you get to your goals quicker. How do I know that? I'm the patient.
Patient's here, right? Yeah, look, good.
It took me, I'll tell you, it took me 2 years to figure out how to make cannabis work for me. And that was combining cannabis plus other phytobotanical nutrients, other adaptogens, neurotropics, Ayurvedic herbs. And so now I'm like, now that I'm seeing that these symptom targeted formulas are coming out, and that you've created them, and that now we're creating them, we're really going to be able to hone in on what is needed for patients to get them to those levels of wellness quicker, right? Quicker.
100%. And I also don't want to make anyone feel that's listening that if you're taking one of the earlier style of tinctures that it doesn't have a place, because it does. And if it works for you, that's great. This is just kind of another level, another layer, peeling back the onion per se, that's there. Because we also make the MCT full spectrum type tincture, and a lot of people love it. And what I tell people is, if you're not necessarily having that specific ailment you're trying to fix, you don't have a back pain that's just consistently there for you. You don't have issues sleeping, but you believe in the power of CBD and cannabis or hemp in general, and want to use that as a daily vitamin. That's what I think that product is for, is that consistent dosing that we talked about, taking it like your vitamin C pill, vitamin D pill. Use that product for that. And if you choose to kind of want to experiment a little bit more with more of a functional blend, that's what the essential line is there for. That's what we're helping you out with your blends, is really coming together to make those. But don't think that, hey, this is pushing you away from that
not at all.
That might work, because it's very beneficial still. I mean, so but I just wanted to make sure people understood that.
Absolutely. And that's the thing too, is we're having a thoughtful, intentional conversation on these different things. This is when people will say, Sherry, does this work? Does this work? Does this work? I go, listen, everything works and nothing works. We got to figure out what works for you. It's
very good way to put it.
Patients specific. And also I always remind patients too, is as you get better, as your endocannabinoid system gets nourished, as you start to feel better, your cannabinoid requirements may change over time as you change. I'm a completely different person than I was 7 years ago. What I take for cannabis is different. That may not be the same for everyone, but I always like to put that bug in people's head. If you find that a formulation isn't working for you anymore, reach out to us, right? Because cannabis works, CBD does work. Your product, you may need to switch up the type of product you're taking, the different oil that it's carried in. You may need more terpenes, less terpenes, more other supplements in there. You just don't know. So when people, and the same thing, I completely agree with you when you say, people will try it 1 or 2 times, or they'll try it for a week and they say that it doesn't work. It does work. And that's,
yeah. And I got a
and we
question
have
for you, Sherry.
Sure,
Like, so you mentioned using these products for a long period of time now. Have you so what is your dosing levels done? Have you had to increase the levels as you've gone, decrease them? I'd be curious to kind of hear.
So I'm going to
have
tell
done.
you, interesting enough for me over time. And it's very, very interesting because I am taking a lot of other supplements. I do Ayurvedic herbs. I do medicinal mushrooms. So not necessarily the psilocybin, that's a separate topic, but I do a lot of mushroom tinctures. And so my requirements for THC have gone down tremendously. At first, when I first started as a patient, I needed a lot of THC. And then now what I've found is CBD, rich CBD formulations and these other botanicals that I'm talking about, the Ayurvedic herbs, the different supplements that I take have truly been instrumental in allowing me to not need as much THC to manage my symptoms. And my symptoms have been across the board, from gastrointestinal, autoimmune, chronic pain, and then all of the other mental health challenges that go with that. PTSD, agoraphobia, panic disorder, anxiety, and depression, which can be very surprising to people, but I'm not going to lie. This is the truth. I like to be very transparent on the podcast, and to let y'all know that I was very, very, very sick, very sick. And over time, my requirements, I don't need as much as I used to. I really, really enjoy CBD and these other formulations. I'm always looking for ways to specifically help patients save money. Right?
Yeah.
Because as a patient, I dumped thousands and thousands and thousands of dollars.
You go down a rabbit hole and you find things and spend money on it. And someone recommends this, so there's another $70. I mean, it adds up quick. And the reason I asked that was, I mean, first of all, it's very commendable, you like being very open with your viewers here and sharing your story. But what I asked that for say, because I think a lot of people, there's a misconception about the quantities of CBD that you have to take. As you know, with the endocannabinoid system, we produce 2 different types of endocannabinoids.
Anandamide and
2-HG. Correct. That's natural to the body. The goal of CBD isn't to replace those. We want our body we want it to make more of those naturally. And some people will start taking CBD and they'll start taking too much of it. Though they might feel as if they're getting more out of the product, what happens is now you're telling your body that you don't need them to produce as much of your endocannabinoids, the 2-HG and the anandamide, right? Because now you're supplementing it with more and more CBD, just CBD. Right. So the goal is to kind of find that perfect balance. So you're not just loading up with it, because then when you cut off completely, now your body is making a minimal amount.
I find that more with THC than I do with CBD.
You do? Okay.
So yeah.
This would be an interesting conversation with Dr. Pi, because I'd
absolutely.
He loves talking about this part of it.
Yeah. And the reason why is because if you think about the THC molecule and the anandamide molecule have a very similar molecular shape. Okay, when they plug in, CBD does not lock in directly to the CB1 receptor. It's an allosteric modulator. It docks along the side. So CBD is either dialing up or dialing down THC. It's a modulator. It dials things up. It dials things down. CBD works on 76 molecular targets in the body, which is very different than THC. And so what I found more along the lines is the anandamide molecule. So too much THC, very similar to insulin, right? If you're, we create insulin to carry glucose into our cells. Okay. So we create anandamide to bring messages, to send messages to the neurotransmitter signaling systems, to give messages to our different organ systems to either do something or stop doing something. So if you're flooding your body with THC, what happens is your body says, oh, thank you so much. I don't need to make any more. Okay. More so with THC than CBD.
Interesting. Okay.
CBD. Yep. And so, but here's the interesting thing too. So when patients come to me with CBD products and they'll say, Sherry, it's not working anymore. I'll be like, what's not working? Like, what's not working? CBD is not working. I go, oh, CBD works. Let's talk about what you're doing or not doing in your life. So then what we'll do is we'll go down the rabbit hole of seeing what activities, foods, what are you eating? What are you drinking? Are you drinking alcohol? Are you sleeping at night? Do you have stress in your life? How's work going? How are the kids? Do you have any new conditions? Have you heard, like you just go into all of the different things that could affect their endocannabinoid system and you ask those questions. If nothing has changed, then my next thing is let's cut back on the amount that you're taking to see if you have a better result. So we'll cut back on the amount that they're taking to see if they have a better result. And if they have it, sometimes they'll have a better result, sometimes they won't. It'll be the same. That's when we go to change formulations or methods of administration. So it's kind of like a little logarithm that we've been working with nurses, as nurses, when we're working with patients and they call up, oh, it's not working anymore. I go, I promise you it works. It works. We just need to figure out what's going on in your body. But just because you think it doesn't work, I don't want you to think that that's bad. Okay, because this particular product not working doesn't mean that it's not working. It may mean that your endocannabinoid system doesn't need this product anymore. You may need something different, a different type of formulation or a different way of taking it. So a lot of times we'll see patients that'll come through with us and they've taken the same thing for years and years and years. And I specifically see this with inhalation. Patients will come to us and they've been inhaling and inhaling and inhaling, and it's not working for them anymore. They're missing so much of that and how to work for them. And then all we do is we just switch it up, do a little care plan, reset their receptors. And then when they go to inhale again, the inhalation works better. And then they have the support of the rest of the plant using CBD rich formulations. So it's, like I said, it's different for everyone. But I completely agree with you that the goal of cannabis as medicine is to stimulate our own endocannabinoid system to do its own thing. Our body is extremely intelligent. The intelligence of the plant is really kind of hokey and miraculous. And I'll say this to patients all the time. And I'm like, you know what? The plant is intelligent for our complex bodies. It's almost as if it goes where it needs to go and does what it needs to do to bring homeostasis and balance. It's just a journey that you need to embark on to figure out what works for you. And it's very, very safe and very, very effective. And that's what we're doing with patients. We're teaching them how to fish instead of giving them the fish. You know, we may give them the fish the first appointment, but subsequent appointments is what we're really doing is just teaching them how to listen to their body.
Yeah, being in tune with oneself.
Yes. And the more you work with the plant, the more you're going to be in tune with yourself. Seriously.
And I'll tell you what, like, this is kind of cool. Like when I first started playing with those different extracts, right? Like we talked about the coriander, the California poppy for the calming tincture, the black seed oil for the pain relief. Like, you do start to notice the different feelings, like especially like because I would take CBD and I knew what CBD felt like, especially if I was taking full spectrum because it has little tiny bits of THC in those products as well. So you kind of get the feeling of that as well. But then when I started adding those other extracts in, you really do start to become a little bit more in tune with like how you're feeling, whether you're feeling tired or are you feeling energized. And so that was a really cool part of this process was feeling like, what does ashwagandha do to me? Okay, well, let's make a tincture with a little ashwagandha in it. How do I feel after 30 minutes? Do I feel anything at all? Am I feeling anything? So I would start to kind of notice the difference. And I think when you start and take a step back and try to pay attention for those feelings, that's when you start to become a little bit more in tune with your body. Oh, did we lose you?
Oh no. There we go. Are we here?
Yeah. Did I break up on your end?
Oh, that was interesting. You know what? It was interesting. It looked like we both broke up, but here we are. We're back.
I was dropping some knowledge right there. So unfortunate for everybody. Just kidding.
Well, it looks like we are actually back on live. So yeah, there we go.
There we go.
Good. All right. Well, you know what I really want to get into really quickly, because we have like 10 more minutes left. I want to get into quality control of CBD products.
Mhm.
Because I think this is really, one of the questions that I asked for you is, did you see a problem in the industry with quality control? And what steps have you taken at Bloom? Um, what steps did you take to make sure the quality of Bloom's product would exceed your expectations? So this is
Yeah.
really important to me, because as nurses, the patients are coming to us all the time asking us, and that's why we developed Green Nurse Approved. So I want you
Mhm.
to share a little bit about that while I pull up my handy dandy little graphic here.
Yes, and I have a pretty strong take on this because I want to say, like, preface this with there are a lot of great CBD companies out there that follow the standards of quality control, and they're testing their products rigorously, and they're doing full panels. So I don't want to sound as if we're the only one when I say this, because I think over the last 5 years or so, it's really improved dramatically. Now, are there still some black sheep out there, some outliers that are doing it the wrong way? Yes, there are, but I do feel as though especially over the last 2 years, 3 years, the industry has weeded them out. And so I've been in this space for a long time, so I hear this. I mean, I've heard this regularly. But when you're looking for product, look for that full panel testing, and so you could kind of follow along and see that. And that's kind of the standard nowadays. You've got to have that. You've got to be able to show your customers and the consumers what is in their product, and if there's anything that they should worry about. One of the things that we did here, so back to my original story, the company that I helped start and get off the ground, I ended up leaving, and that's when I started Bloom, about 3 years after we got rolling with it. And so at that time, though, there were a lot of issues with just kind of bad products on the scene. And this was when the wave really kind of built up, and CBD was everywhere. You saw it in gas stations. You saw it all
Oh,
over
yeah.
the place, right? That was like when that first started happening is when the bad products were out there. Since
Right.
they've been, but at that time when I left, that was a huge issue. And so what we decided to do was we started growing our own hemp. We got we partnered with a farm out in Littleton, or excuse me, Longmont, Colorado, and we got the farm USDA certified. So we grew USDA certified organic hemp, and at the time, we were one of the first to do that. There's rigorous policies that went into it, making sure that you were following the USD guidelines, making sure pesticide, anything bad that could touch that plant. I mean, you guys have seen organic products at the grocery store. Our hemp was some of the first hemp in the country to allow or to have that certification stamp. And so that allowed us to not only use a cleaner product or a guaranteed product, because again, I don't want us to take away from other people what they were doing, but allowed us to use a cleaner product that we knew that was top of the line, that it was as good as we could have made it. And then we used that and started using it in our own formulations, and we still use it to this day. And so also, in order to use USD organic hemp, you can't just now mix it with MCT oil in the office. You had to go through rigorous testing to get approved, your manufacturing center approved to be USDA certified organic. So our manufacturing facility is USDA certified organic, which then allowed us to use that hemp that we grew to make certified organic products. Now, long story short, here is the cannabis space and certifications with the USDA organic agencies is still a little bit far behind. So we are only able to certify certain products that we make because of all the ingredients that go into it. For example,
Right.
USDA certified or the USDA agency will recognize the hemp extract as an organic product, but they don't yet recognize terpenes. It doesn't make much sense because the terpenes are in the oil that we made, but if we want to make a terpene profile specific for digestion, we have to add terpenes additionally, and it's not yet recognized by them. It will get there, which is why you don't see the stamp on these essential products, but you see it on our MCT oil-based tinctures that are just MCT hemp oil. It's a little bit far behind, and that's expected in growing
Right.
industry that's still, I mean, pretty much in its infancy stage from a worldwide perspective. I mean, maybe here in the United States, like we're just used to it, but I mean, go to other parts of the world. I mean, they're where we are 5 years ago. So it's just a little bit far behind. Yeah, right. And so it's kind of crazy to think of that. We live in a bubble here, and we're very fortunate to be in this situation we're at and be able, because we work with companies worldwide to help them create products. And we talk to them, and they're, like I said, they're where we are 5 years ago. So it's going to come from them. But I digress there, but yes. So what we did was grow our own hemp, and that was a learning experience in its own. We of course had farmers that were very experienced with it, but just being a part of that for the first time was one of the coolest, most like educational time of my life, but also one of the hardest working times as well. I mean, it's a process, especially to do it organically. So we still do that. We're still using our extracts from the farm, and we intend on continuing to do that. So, but that's really how we controlled the supply chain. Is we didn't trust anyone else to do it. We went out and did it ourselves, so we could keep an eye on it. So yeah, that's kind of where the quality control stems from the seed itself. Amazing. Yeah, no pun intended there. But yeah.
Seed to sale, right? Yeah. And so, and that's the part that's great too. So as cannabis nurses, we like to look at products that come from flowering strains of hemp or the cannabis flower, lab tested for purity and potency, looking at cannabinoid profiles, terpene profiles, residual solvents, any pesticides. We want to make sure that there's organic practices and as much of the whole plant as possible. You know, we do approve, we do Green Nurse approved for isolated and full spectrum products because we do see that there is a need for those, and they are medicinal, they are medicine, and they do work really well. And we just make sure that they follow the same, protocols that our other Green Nurse approved products fall under, purity, potency, lab profile, certificate of analysis. We like to meet the owners of the companies. We like to see how they're manufacturing, what their customer service is, what their website looks like. Do they have, are they, helping people? You guys have an amazing program where you do auto ship every month, right? So you're really, really helping the customer dial in to what they need. Your customer service. Your website is amazing. You guys have done a great job, and I'm really honored to be working with you, Dr. Pai, and Graham, your formulator. So you guys are doing amazing things, and awesome. And it's really, and I know that you formulate for a lot of other companies. So if you're a company out there and you need to speak to someone, you definitely want to speak to Tom of Bloom Hemp for sure. He's the guy. He's the man. He's been doing it for a long time, and like I said, I've been working with Elizabeth, the founder and CEO of Holistic Caring, and she's the clinical director of Canam America. And we've been formulating. And so it's been really an honor and a pleasure to be working with you and your team. You guys are doing great things. And we can't wait. We're in R&D right now. We can't wait to get our formulas out there.
They're very kind words. Thank you.
You're welcome. So listen, how can people find you? I know I already put up an ad for this. bloomhemp.com.
Beautiful ad, if I could say so too. I love
it. Thank you. So Green Nurse for 10% off and free shipping. So go to www.bloomhemp.com. Make sure you enter into that code. I highly recommend. I have tried all the formulas. Calming tincture, the tincture for digestion, I love, is my favorite. And the recovery tincture. So the calming tincture, I would say, that I've been experiencing this, is great for anxiety, and it's also good for sleep, right? So if you think about calm sleep, you want to be calm throughout the day, right? To manage your stress so that when you go to bed at night, you can sleep good. So that's why I like this one. This one's amazing as well. Recovery tincture for pain. Really, really like it for sore muscles. It actually too, I didn't have my calm one on me when I was anxious, and I took this one for anxiety, and it definitely helped as well. So just look at recovery from what? Recovery from everything, right? It's a great way to recover. And it's got some really, really good products in here. Black seed, turmeric, ginger, and black pepper. And so, really, really doing the research on this and how those different ingredients can enhance the effectiveness and the therapeutic potential of CBD. Really good stuff. All right. Any last words, Tom?
No, well, if you guys have any questions at all, don't hesitate to reach out to us through the website, and we'll do what we can. It's what you're doing over there is great, Sherry, and I think you nailed it on the head. Education is key, and there's no dumb questions in this space.
No,
so please reach
not at
out if
all.
anything whatsoever, and we'll be glad to help.
Absolutely. And so make sure you visit our website, www.holisticcaring.com. Bloom Hemp is in our Green Nurse approved CBD marketplace. Make sure you also join our free network, free intro to cannabis course, patient portal, patient support group, and book club. And we're going to have some of other Bloom Hemp team members on. Dr. Pai is going to come on, and we're going to have a wonderful discussion with him, as well as the formulator Graham, who we've been working with. So Tom, thank you so much for what you do for everyone in the community, for our patients, for providers, and for companies. Thank you for really up-leveling it and sharing your story, your experience, your strength, and your hope. Looking forward to working with you in the future and continuing to work with you in the future. And remember, everyone, what it's all about. It's truly about living your best life and helping others do the same. We'll see you next week.
Awesome. Thank you. Have a good
We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And you know, the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.